Welcome to Fact versus Opinion. In the previous video on Fact versus Opinion, we discussed and reviewed many randomized clinical trials done on bypass and angioplasty, comparing it with medical management alone. The primary objective of these multiple trials done for the past 30 years is to prove beyond doubt that angioplasty or bypass surgery, when added over a medical management in patients who have stable symptom, will provide mortality benefit. It means it can prevent a heart attack which can lead to death, or can prevent a heart attack where the patient still live. It's a non-fatal heart attack or death itself. So these are all the primary objective a invasive procedure is given to the patient. And all the trial, when they come up for the conclusion, it concluded that these trials were not able to provide evidence that this procedure can able to prevent a death and heart attack in patient with stable angina. This is quite surprising, because this is why a invasive procedure is added over medical management. But in spite of that, the patient did not derive any benefit on mortality and morbidity. This provides a big question. But in spite of that, bypass and angioplasty over medical management is being practiced because the secondary endpoint are called soft endpoint. But even though these invasive procedures were not able to alter the outcome, it can able to provide a significant improvement in the symptoms of the patient. So most of the time, the patient comes to the physician not because they have a block or reduction in the pumping function, because of the symptoms. So these procedures, even though they are invasive and have a considerable risk of death because of the procedure itself, they were able to provide a considerable improvement in quality of life and reduction in angina or shortness of breath, which are all related to the disease itself. But the primary question every patient should know about this is, are they taking this highly invasive procedure only to get some improvement in quality of life, or they are looking at beyond quality of life, like reduction in heart attack and death? So this is very important in patient perspective. So even though now the secondary endpoint, which is a quality of life, is improved, patient wise the mortality benefit has not been proven until today. Then the quality of life improvement, is it 100% sure that the patient is going to achieve? It is another question which is raised by a group of physicians in United Kingdom along with 5 hospitals. They put a hypothesis. In fact, they question the belief which has been sustained in the medical community for almost 50 years from the invention of angioplasty, that doing an angioplasty and stenting would definitely improve the quality of life. This was never been questioned in the past 40 years after the introduction of angioplasty. But again, there are trials which has done for the past 15-20 years, which are randomized clinical trial, which did shows there is an improvement in quality of life. But this group of physicians challenged it with another form of trial called placebo-controlled blinded trial. This is a randomized, it is a blinded and placebo-controlled. Now these placebo-controlled trial are one step ahead of the randomized clinical trial, because it may able to give an absolute answer, yes or no, to a question. So what is placebo? So placebo is something is attributable to the procedure. A procedure is done to a group of patients, and this patient tend to believe that they got the benefit from the procedure, but actually it is not the procedure which has given them the relief in symptom. It is a psychological feeling that they have undergone the procedure. So this placebo effect are very high in equipment or invasive procedure when compared to the medical procedures. So the first randomized placebo controlled trial was done in a procedure called internal mammary artery ligation. This was a procedure widely spread across the globe before bypass surgery came into the existence in 1960s. So this is a procedure done to relieve angina in patient with coronary artery disease before bypass surgery. So simply they open your chest and then find out the internal mammary artery and ligate the artery so that the blood flow to the heart muscle can be improved. So initially there was a profound improvement in angina, So patients who undergone this procedure said their angina has gone, it's reduced up to 100%. It's amazingly great procedure to be done on patient with angina. But many critics point out maybe this could be a placebo effect. So finally, when they did a placebo trial comparing a group of people where they open up the chest cavity and ligate the internal mammary artery, and comparing it to another group of people, they open up the chest but they don't touch the artery or ligate the artery. Then they followed up for the couple of months or years, they found out both the group have the same reduction in angina. So basically it's a conclusion, it is not the procedure which has given the relief, it is a confidence that the physician has impart into the patient's mind that their procedure will work, has given a psychological advantage to the patient and they feel that angina is gone. So this is what the history about placebo trial. So this group in United Kingdom want to try the assumption that the chest pain reduction because of stenting or angioplasty is simply a placebo effect rather than because of the procedure itself. So what they did is they designed a trial, and this trial was published eventually in 2017 in one of the most prestigious journal in the world, which is Lancet. So this trial is called Orbiter trial. What they did is they took two group of people. So they choose 200 patients and 105 patients are asked to go for an angioplasty and 95 patients are asked to go for a placebo procedure. It means what they did is they picked up a people with have proven coronary vessel disease. So they do an angiogram, they find out, and these patients should have at least one vessel blocked. So it is a single vessel blockage. And this blockage should be more than 85% or across around 85% blockage. So the blockage is very significant and it is a single vessel. And then they did many things to show that because of the obstruction there is a significant reduction in blood flow to the heart muscle by what the procedure called FFR and IFR. So fractional flow reserve and instantaneous flow wave ratio. So all these things are done to make sure the blood flow to the heart muscle is significantly reduced because of the block. So 101 patient, they asked them to get into the cath lab or the operation theater. They put the catheter inside the body, move the catheter into the artery where there is a blockage, and in 105 patient they really put the stent. And remaining 95 patients, what they did is they took them to the cath lab. So they all given a music, so they won't hear what has been spoken in the cath lab. And then they introduce the catheter into the body as if they are going to go for a stenting, but in fact after reaching the artery they never stented the artery. So the caregiver or the patient are blinded, nobody knows what procedure they have undergone. So the physician who did the procedure are also asked not to be in contact with the patient after the procedure is done. So these patients, nobody knows who has undergone a real stenting and who has not gone for a stenting. All were made to believe they in fact had a stent in the coronary artery. Now they are fine. They have started in all the medication requirement to prevent the stent. So the patient believed they are also been stented. They followed up to 6 weeks. And after 6 weeks, what they did is they looked at the quality of life, the anginal symptoms or exercise time. To the surprise, the patient who undergone the real stenting compared to the patient who has gone for a placebo procedure, means they have not been stented, both groups shows the same increase in exercise time and same reduction in angina. So this comes as a big surprise to the cardiology community, because now they have a procedure called angioplasty and stent, which has been done millions across the globe for patients with stable angina. Now the trials have clearly shown this stenting procedure to patient with stable coronary artery disease in a single vessel stable coronary artery disease will not provide any benefit in terms of heart attack or death or even improving your exercise time. This shattered the whole belief in cardiology. In fact, it created so much of controversy. So many of the cardiologists sit together and now the arguments started happening. They talked about the trial is very small number, 200. The trial have not followed the patient for longer duration because the evaluation of the post stenting happened within 6 weeks. So these are all the controversies I've done to made the patient to believe In fact, there is a result, but it's still under consideration because of a lot of discussion and controversy is going down. But let me make it as very simple for a patient to understand what this controversy really is and what as a take-home message from this trial. Well, if I give you a medication which can reduce your chest pain, which is called nitrate or any other medication, we have a couple of medication which we can give you if you know that you have a heart disease, so that your angina can come down and your exercise time can improve. So these drugs, what they do is they can able to improve your exercise time about some 48 to 53 seconds more than what if you don't have this medication. So this medication will improve your exercise time close to let's say 1 minute. Now, when these trials were designed, this Orbita trial to check the quality of life improvement in patient with stable angina with angioplasty or stent, they picked up a time of 30 seconds. So all they want to show, this trial has to be positive, is after adding an angioplasty over a medical management, they are expecting the patient to perform only around 30 seconds more than without the stenting procedure. It is a surprisingly a low expectation for such a high risk procedure, because the patient is going to take a procedure with a high risk. They might die during the procedure, there is a chance they may get a heart attack, or there may chance they go to a renal failure, infection, or something happen while they put the stent. I mean, your vessel can go for rupture or dissection. So in spite of all this complication, the quality of life assessment or the exercise time improvement which is expected of this angioplasty over the medical management is merely a 30 seconds. So which is only 50% of a single medication can do. In spite of this low expectation, angioplasty did not able to show that this patient can able to improve the 30 seconds more than the medical management alone. So whatever the controversy is, because many patients, because when I speak to many of my patients and I said, look, I'm going to push you to go for an angioplasty or a stenting procedure, what is your expectation? Immediately, I think any of your patient who was listening to the video would say, yes, my expectation would, the doctor said, if I get a stent, my chance of heart attack should going to come down. I'm going to live longer, life expectancy is going to more, and then I'm going to go back to my regular activity and be active again. Well, all these things seems to be not an issue for angioplasty, because none of them is true. Your exercise time, even 30 seconds, cannot be increased. So the expectation is like a mountain, and now the controversy they are asking to, they were debating is about 30 seconds to 80 seconds or 40 to 50 seconds. So still the expectation of angioplasty, what can achieve in the patient of stable angina, is very low. So as a conclusion, with all the trials which has been done, including the Orbita trial, in patients who are stable, when they go to the physician, they should know doing this procedure called angioplasty could improve your chest pain, but it could be mostly a placebo effect. So it is not because of the procedure, because of the confidence that you have developed in you that the lesion or the blockage has been fixed. And this angioplasty will not provide you any benefit in terms of longevity. It is not going to provide you long life or not going to provide you any reduction in risk of death. So what you have achieved by optimal medical management, it has been maximized. So if you are on medical management going for this highly invasive procedure, you are not going to derive anything much more. In fact, one of the most critical argument against this trial Orbita, if I can display to the patient, they would know how far the academician or from the normal clinical practice or patient care. There are some cardiologists who argued that the the Orbita trial become negative on improvement in quality of life, because the cardiology who treated this group of patients who are on this procedure effectively with good control on diabetes, good control on cholesterol, good control on hypertension, and they provided enough medication and they managed them very well, so that angioplasty did not work. So basically they are telling you, if a cardiologist is going to put you on a stent or angioplasty, means they are not good enough to manage you on medical management, or as a cardiologist they have failed to manage you appropriately in medical management. so they are pushing you to an angioplasty, or it is a biased view, maybe it is economical that they are pushing you to the angioplasty of stent. So if you are on a good hand, so that is why we have created this program called EECP. So EECP is a non-invasive treatment option where the patient comes for 35 days to improve the blood flow to the heart muscle. So we optimize our medical management. At least we introduce 1 or 2 medications which can reduce your chest pain, and some medication to prevent the heart attack risk, and some medication so that the heart pumping function can improve. So all these medications and EECP put together, I think we can able to achieve much better than what angioplasty or an interventional procedure can achieve in stable patients.